Earlier on this week, Business Daily published an article reporting that more than 50% of all educated women in Kenya are obese. It's quite unfortunate that as a dietitian I actually agree with those findings, because in my day-to-day activities I deal with women of reproductive age. Why should it concern you that you are a woman of reproductive age and you are obese? Number one is because obesity has been linked to infertility in so many ways. The first reason that obesity causes infertility is because it causes hormonal imbalances, and this makes it harder for women to conceive. There are a lot of studies actually associating obesity with leptin insensitivity, and leptin insensitivity has been directly associated or linked to infertility in women of reproductive age. So what is leptin and why should it concern you as a woman who's obese? Leptin is the hormone that tells your body, okay, fine, Mumina, we've had enough, we are full, let's save the rest for later. That is leptin. And you see, for most obese people, or even most obese women, they have leptin insensitivity. This means that they have no control of how much food they eat. This expands the stomach capacity, increasing storage, and thus is where we get obesity and overweight in the long run. When you have leptin insensitivity, you're bound to have insulin issues, you're bound to have thyroid issues, you're bound to have estrogen and progesterone issues, and this definitely will affect fertility in the long run. The second reason that obesity has been linked to infertility is because it makes it harder for women to carry the pregnancy to term. Like, obesity has been associated with preterm and low birth weight babies. When I was in Thika level 5, the maternity section did a small study like on the low birth weight. There are numerous studies that support that obesity and preterm and low birth weights go hand in hand. It makes it harder for women to carry a pregnancy to term. The third effect is that obesity predisposes women to pregnancy related complications like gestational diabetes, gestational hypertension, low HB counts, and others. And all these have a negative impact on the pregnancy outcome. And the next one is that obesity has been linked to a lot of miscarriages and a lot of stillbirths and such, because of the hormonal malfunctions and other metabolic malfunctions that happen in the body. You see, there's a lot of changes that come with being pregnant. If you're planning to conceive, it is advisable that you start working on your metabolic health, hormonal health, even before, so that you can have the best outcomes when pregnant. Of course, there are things that only the Messiah can control about pregnancy and outcomes, but there are those things that we can actually control by adjusting our eating plans, by making sure that our pre-pregnancy weight is good, our pre-pregnancy metabolic and hormonal functions are good, ensuring that our thyroid function is optimal, and other things. So those are some of the effects of obesity in women of reproductive age.